whenever someone mentions money, funding, or defunding the police, or same with taxes, anything that involves money, the first question you have to ask yourself is, how much money do we currently have? And the second question is, where is it going? And the third question is, how can it be reallocated? After that, you ask about more funding or less funding. So let me ask you then, where do you stand on the fund or defund the police, either for American or Canadian police?
I think there's a sweet spot between looking at the funds and, I mean, not just saying, well, like, okay, as of tomorrow, everybody goes home, we're done with police, but to say, what are the jobs that are specific to police officers that only police officers can do? Let's get them doing those jobs. What jobs can be better done by other agencies who are already getting funding or who could use a little extra funding that's not near as much money as we're putting towards policing to resolve the same issues? Like, for example, mental health issues. Police officers get mental health training, but police officers are not mental health workers. Police officers are not psychiatrists, they're not psychologists, they're not public health nurses, they're not any of those things. And I'm sure it's the same where you are, but here in Canada, our public health is underfunded. Our street level nursing is radically underfunded. And to say, okay, well, instead of having a police officer who chose to be a police officer rather than a public health nurse because they don't really want to be a public health nurse, why don't we take some of that money and put it towards public health? And so the times where police officers get called to those types of calls is where there is more of a police/enforcement apprehension element involved, as opposed to a counseling component and a long-term solution component, which comes from our social services.
Mm-hmm. I'm with you 100%. At least I was, funding more mental health, 1,000% with you there. Now, when you say the funding should come from the police, why?
Well, I'm saying the money that is allocated towards the police budget.
Okay.
Like, for example, in Toronto now, I believe the police budget is over $1 billion.
Mm-hmm.
It's a lot of money. So if they looked at how much of that money is spent in, say, for example, public health type initiatives, responding to public health, all of that, say, okay, let's take a little chunk of that and give it to the agencies that are already doing that kind of work.
So you want to rearrange funds within the overall big police budget?
Take the money, some of the money from the police budgets and take it out and put it into the public health budgets.
Okay, but that is under a different umbrella completely. So it's like take it from box A to box B, you're not rearranging box A. Yeah. So that I understand that argument, but my thing is, we need to fund mental health, right?
Yes,
that is something we can both agree on.
Absolutely.
But why does the money to fund it need to come from the police? Why can't it come from elsewhere? Like, why can't it come from taxation, right? Or why the police? Why not the military? If in the U.S., I would say come from the military. Why the police? Because the police could use that funding for other things to help the police mental health or the police training. Like, why does it need to come from the police? I think that's a big disconnect in this conversation. Is why should it come from the police budget?
Well, I'm saying, just for argument's sake, let's say $10 million is spent annually, and it's like way more than that, but $10 million is spent annually for police officers attending to low-level mental health calls annually. Why don't we then say, we're going to take that $10 million and give it to an organization so they can hire like way more staff, so those calls never get to the police?
Where would they go then?
Where would who go?
Where would the calls go, and who would show up?
Then they would go to the mental health people.
Okay, so
instead of the police, so they never go to the police.
So as you say, mental health police officers aren't mental health workers. Mental health workers aren't cops.
Right.
So that's the flip.
Yeah.
So if I'm a mental health worker, my mother was a mental health worker. She worked with very violent people in like a mental hospital. She had to do with people who not overdosing, the opposite of overdosing on heroin, withdrawals.
Withdrawals
on heroin, and like in a hospital. And there are guards in the hospital. There is something she couldn't do without a guard because it was dangerous. So while a cop is used to danger, they're not used to mental health. Mental health is used to mental health. They're not used to danger. So I don't think you should send a mental health worker to a police where someone is super disturbed and they have a gun or a knife, right? But you need to apprehend them, and then you send them to the mental health worker in an opportunity for mental health worker to actually do their job.
Yeah, agreed.
Right?
Agreed. Yeah,
and if I misrepresented your point, I apologize. But it's a general argument there.
Yeah, no, I mean, I certainly wouldn't say, like mental health workers, off you go, because but what I would suggest is that if we can deal with mental health issues more at a grassroots level before they escalate, we may have less calls to service, because you're always going to have mental health calls to service.
Of course.
Say with somebody who is having a psychotic episode, something like that, but there's a lot of times where police are involved in things that really aren't policing issues, or people are just not managing, they're not coping, they're not a danger to themselves, they're not a danger to anybody else. They just need somebody to talk to.
So why should the budget to fix those problems come from the police when it shouldn't have anything to do with them in the first place?
Well, that's it, right? It shouldn't have anything to do with them in the first place.
Right, but the solution, but you want to fund the solution through the police budget.
No. Sorry, because what I'm looking at is the budget's there. Mm-hmm. Leave the budget, but somewhere you have to come up with money to fund these other things.
Right.
So where are they going to get this money from? Right. And
you're saying the overall police budget.
If they're taking responsibilities away from the police, then maybe they can take some of the money.
That's a very good point. Okay.
That's what I was trying to say.
Okay, gotcha. See, that was a big disconnect for me. Like, I understand, like, no, after, I don't know which example I want to pick in the States, pick one, right? After that happened with the defund the police movement, the idea was this money should come from the police. And I just never understood that. Like, mental health is a problem, but what does that have to do with the police? But your response is it takes the burden off of the police, levy the financial burden as the unit out.
Yeah.
That is the best argument I have heard for why the money should come from the police. So, thank you.
I'll take it.
I appreciate that, because that actually helps. Now, whether I can disagree or agree with you, I understand, right? I don't need to agree with you. I just need to understand. So that was perfect.